Good afternoon. Welcome to the Auburn Rotary Club. I'm sorry you were not feeling well and you couldn't make it today, but thanks for being our first Zoom meeting.
You're very welcome. Thank you for accommodating me today.
Gives me great pleasure to introduce today's guest speaker, the Madam Chairwoman of the Cayuga County Legislature, Aileen McNabb Coleman.
Thank you, everyone, and thank you, Ed, for reaching out to invite me to speak with you today. I deeply regret not being there, as I saw pictures of the amazing food that Cafe 108 provided. I love to patronize that establishment as often as I possibly can. It's delicious. So, Angela Dodabo is doing an outstanding job down there. So I asked Ed, can you hear me okay?
Yes.
Yes. I asked Ed, what should I prepare, what to talk about? And of course, the highlight of this past year, especially this past year, the pandemic response of the county. So I was gonna use that as my primary focus today. But just wanted to give you some information about myself. I don't know all of you, so I'm pleased to introduce myself to you. So I am currently the chair of the legislature. The county legislature is in the districts throughout the county. I grew up in Auburn. I was living in Owasco when I ran for the legislative seat that represents Owasco and Senate. And then I have since moved to Senate, and I'm still remained in my district. And then this is my 5th year on the ledge. And last January, they elected me to be the chair of the ledge. So I represent the entire legislature. It was a unusual role to step into because typically we have an administrator at the county level who handles operations, and we were without one. So I started last January, essentially independently in this role. And by the end of January, I did attend a NISAC conference, the New York State Association of Counties, and I went through 3 tiers of emergency management training. So I took 2 during that conference, and then early February I finished and completed my 3rd tier of emergency management training. So the training at that time, we were focused on snowstorms and flooding mostly for our county. And there was maybe a slice that they talked about a pandemic. Nobody really paid attention to it, and it certainly was not the focus of conversation. So, but it was in my material. It was definitely in the table of contents, so I knew where to go when all of this started picking up. But it was, I felt very energetic and ready to tackle whatever anything came our way. 2nd week of February when I completed the training. So little did I know that the pandemic was looming into the near future. Upon being elected chair in January, I had all these great ideas, and I have a little sense of humor about it. I'll say, back when I was a child, when I was innocent in January, yeah. I had all these great ideas for capital planning, and I wanted a new building set for the county, for our county operations. We have water quality issues I wanted to tackle. We have upgrades to infrastructure, especially with water, through our water and sewer authority. We have a huge project looming for the entire county to benefit from, especially the residents of the city of Auburn. This would provide a second source of water for the residents of Auburn. So, and then I was also interested in looking into the leadership of county government. What could we do differently? Did we want to adopt an administrative form of government? we wanted to embark on a county charter. So it was all these great things that were going on that I had really great big ideas and I was excited to tackle. And then on March 14th, I had to issue a state of emergency and do the emergency declaration for our county, and that essentially closed schools on that day. And since then, all of our plans, have generally been overruled by our COVID response. So it's been an interesting ride so far. As I sit with you today, on November 17th, there's 643 confirmed cases of COVID in our county that has been confirmed over the time of these several months, from March 18th to November 17th. And March 18th was our first case after the declaration of the emergency declaration took place and we closed schools. We didn't even have it in the county yet, but clearly we knew it was rolling across the state. And today, as I say here, there's 607 people in mandatory quarantine. Those are people that have been exposed to a positive case. And if you're in mandatory quarantine, you're essentially trying to separate from folks in your home, and you are to follow orders from the health department in order to keep yourself safe and secure, and to check in about your whereabouts because you're supposed to remain on your property. There are 117 folks in our county that are in mandatory isolation. And isolation means that you're presumed ill. So you either have COVID or you're waiting for results. And those folks are in constant contact with the health department. And to date, we've had 7 deaths associated with COVID-19 in our county. So the past 9 months have been quite a ride, and I never would have thought I'd be sitting here talking to residents such as yourselves about, and refer to deaths due to this global pandemic that has definitely made a home here in Cayuga County. Throughout this whole process, definitely advocacy has been my charge. Fortunately, I have some experience with advocacy. I'm a teacher. I taught half my career in special education and the other half in 5th and 6th grade in general education settings. And I love your campaign for Warm the Children. I always did that in my classrooms and with our teams of teachers, and we always were pitching in and bringing in coats for our students who were in need of additional clothing, winter clothing, but also school supplies. So I really appreciate your program there. But advocating for students was something I was always very proud of and very strong at, and now I've turned into an advocate for the county. And as Ed knows, I know Ed personally, I was the 4th of 5 children, and I know how to be a pest, so I've relied on that, those skills that I was inherently born with in order to get things done. So advocating for testing has been, it's a daily fight. I'm on the phone with the governor's office very often. I actually talked to them last night around 8:45. And well, it's very difficult when we live among other counties that have access to either upstate and everything that they're trying to do, or even to the south. We have Tompkins, and they in Cornell, and they're trying out new methods. They're trying to get a pool of data, so they've included the public into that pool that benefits the public and getting results. So this has been very difficult through this whole time, because I think Cayuga County deserves the best that we can possibly get, and it's been a challenge to get the attention that we need. Although I will say that I have learned in our regional control group, we are associated with 4 other counties. We're in a group with Oswego, Hamilton, Cortland, and Onondaga County. We speak every day, and when we talk to our state leaders for our regional control groups for attacking COVID, I'm very patient. I'm the quiet one of the group, so they do know when I do raise a need for our county, they seem to listen and they seem to respond. So, as well as all of our federal and state elected officials, we've become very close friends at this point, and we're on each other's text lists and phone calls very often as well. So we are, getting there just when we think we are okay with our supplies and we're doing okay. We get into kind of a rhythm for a week or two, and then something else happens, and we have to kind of go back to the drawing board and we start again and pounding that drum. So again, this is ongoing, and I'm happy to do it. It gets me out of bed every morning, and I've been a very strong advocate, and I think we've been doing very well in getting the supplies that we need. So we just got to keep going at this. Clearly, the partnerships with the health department and the other counties is a very strong partnership, and Kathleen Cuddy, who is the director of the health department, and I speak multiple times a day in trying to do what's best for the residents of this county. But it's been interesting 9 months. In the beginning was interesting as well because everything shut down and everyone was just focused on one thing, and that was the COVID response. And now, since then, we have, learned to live with this pandemic. So that means we have other things that we need to accomplish as things go on. So I thought I was busy in March when I'm very busy today. I just developed the new budget for the county. As I referenced earlier, there's been no administrator. I have been, as the chair of the ledge, I have been acting administrator. I oversee all the operations. I don't have a secretary. I make all the copies. I answer my phone, and I set up meetings. I do everything. So I also am the budget officer of the county since I'm acting administrator. So I had a big role in putting together the budget for 2021. I think after a lot of hard work and a lot of collaborative discussion with departments, we were able to come up with something that I feel is a very strong, responsible budget that has very minimal impact on our residents in terms of any sort of tax increase. So, but it's been an education. One of the things that I've been able to put in the budget was leadership structure for county government. We've been having a lot of conversation about the future of Cayuga County and the future of the leadership of the county. And the legislature is not interested in having an administrator anymore. So we're enacting a new leadership structure that has a full-time chair of the legislature and an operations officer, and then clerk to be shared amongst the two. So that's in the budget. Whether or not it gets voted on is another story. We'll see what happens, but certainly for me, that's kind of the light at the end of the tunnel for help on the way, because it's been a struggle, but one that I'm very honored to do. I'm very excited to be part of this. As some of my close family and friends say, of course you are, because I would want to be the one in the room when the decisions were being made and know exactly what's going on with the conversations. I've been very happy to sort of lead the charge for the county in this way. but it's been a full year, and I'm happy to. I'm interested in serving again as the chair of the Ledge next year, but that's a vote that the legislature will take in January. And if I don't, I'll be happy to support whoever's in this seat and continue my advocacy for our COVID response. I don't mean to, I know it's kind of a downer. It's like all you ever hear is COVID, but certainly for my position, that's what I've been living and breathing since March. And, right now everyone's in fear of this microcluster approach with further shutdowns. I was helping my son do homework last night, and the governor's office called. This was a phone call I had that was near 9 o'clock, and I tripped over everything getting to the phone. It was very dramatic because I'm waiting for that call to say, we're going to microcluster parts of Cayuga County or all of Cayuga County. And of course, that would mean testing would grow exponentially for our county. State Liquor Authority comes in and sets up camp. This New York State Troopers Task Force comes in and sets up camp, and they work on enforcement of mask wearing, enforcement of any place that sells liquor. They have to be closed by the new 10 p.m. Guidance that we were given last week. And any sort of crowds would be dispersed, so it would be a heavy lift when that time comes, if it comes. And also, the worry is if we were to get involved with a microcluster, it's hard to get out of one, and it's easy to sink into an orange zone or a red zone. So we're trying our best to get out the word for everyone to continue with mask wearing. I'm so happy to see all the masks there, and social distance, and limit your movement. I know everyone's running around starting to do the holiday shopping. Try to limit your places you go. Keep your receipts. That's what I do. I keep my receipts so I can have a timestamp about where I was. Keep your circle small. I know that you have a great group that you get together for this event. And then you all know each other, and that's great. So you're very aware of who you're around all the time. And I've been telling family and friends and the public, just try to keep your circle small. Try not to bring folks into your home that are not part of your family. Try not to go anywhere where you're in close proximity with folks that aren't part of your household. And then practice good hygiene. That's such an important thing. And my children are, I think they have, very, very dry hands because it's like hand sanitizer all day long. But they are. I've been trying to really impress upon them about the importance of all this, and I continue to do it with everyone around me. But certainly hygiene is paramount. My kids are in school full time in person. So I know that they practice this, and they talk about it in the classroom. So of course I have to ask and understand exactly what goes on there. But this has been, a year to remember. This has just been an amazing, crazy year and full of many challenges. And personally, I know I have grown. I know, everyone has worked together. We work with the city. We work with other counties. I work, with all of our departments and agencies through this process. I've met so many people, and everyone has really done a good job advocating for one another. We've county to county, we share supplies. County gets an influx of something, they'll send it. I've sent things to Madison County. We've worked together. And as I said, we speak daily. So one of the things that we've learned is that taking a regional approach isn't a bad idea. So we're trying to think about other ways that we can take a regional approach to services or to other maybe infrastructure needs, which is great because it's made everyone sort of let down their boundaries and work together and understand, oh, this is okay. This is, maybe this person isn't of my political party, or they seem closed off. I think all the barriers have broken down. Historically, I think the city and the county technically have never really worked very well together, or maybe they could do better. And that seems to be, that's going very well. And we talk every day as well, so.
Aileen, can I ask a question? You went through, the county numbers for COVID jumped by 200 in less than 3 weeks. How bothersome is that to you? And the other thing too, second part of my question is, what do you anticipate with the COVID numbers coming out of, the COVID test results coming out of the prison?
So the jump in the numbers is extremely bothersome and disturbing to me. When we've broken it down, I think we had one high school student in the county at one point. It was probably 3 weeks ago, and that positive high school student impacted 100 people. That's one positive case that impacts so many. The other thing we're finding out is these small gatherings in people's homes. So we're living in the result of Halloween. And a lot of people maybe chose not to trick or treat, but they got together in their homes and had parties or tried to do it outside. And we're finding out that, as the health department is triangulating cases, that's the result of that get together. We had a fundraiser. We saw that in the paper, I think, out at the Finger Lakes Mall. It was the chicken barbecue fundraiser. That has produced an awful lot. That seems to be a kind of a super spreader event on its own. So, I blame fatigue, COVID fatigue. I think folks were sick of it, and they're tired wearing their mask, and they just want to feel normal. And it's human nature. You can't fault people for this. I've gone through it myself, and you think, we can't possibly go through Christmas, and not see family and wear a mask if we did, and this just doesn't seem real. And unfortunately it is, and we need to do everything we can to stay vigilant, and it is very difficult. Changing behaviors, and it's getting invasive in people's lives, and it's very disruptive. So, and it disturbs me now at the alarming growth of positive cases that we're seeing. I don't know what more to say, except we have had some folks who are living the tragedy of COVID reach out and are willing to tell their stories, so more will be coming up. You'll see those in the public. We've had some really heart-wrenching things that folks are willing to share, because they too are disturbed by how this is growing, and maybe that will change people's minds. And the second part of your question was, go ahead, Ed, what was it?
Second, what is your concerns about all the test results that's going to come out of the Auburn prison? There was a lot of cases that came out of the Cayuga Correctional Facility in Moravia. I mean, how bothersome and worrisome is about all the 590 tests that they've said that they've done. They probably have done more by now.
Right, so that has been a struggle since day one. I remember in March being on a state call with all state county leaders, and every county was out of their minds, nervous and upset about the unknowns in the prisons, because they wouldn't tell us anything. It is very And then they seem to have, they definitely grew to be more transparent. And then now it's a little bit, you know, they're close to the vet with some of this information. I did check with Kathleen at the health department. They are receiving updates, but those numbers for the testing is when we get the results, I'm curious to see what's happening there. Of course, Ed, much like you and anybody else in the room, we all know people who work inside the prison. I have a lot of family members that work inside the prison, and they told me all the things, and I've shared them with the health department. I've shared them with New York State docs leadership. I've shared them with the governor's office. So much more can be done to protect those employees. And I've told the employees to go through their union support and to make sure they're being advocated for. Folks were just not getting proper PPE in the beginning of this, or even in the middle of this, and they didn't seem to be responsible to the members, quite honestly. So, no, it is disturbing, and it'll be interesting to see those numbers. I know the Cayuga Correctional Facility numbers were included in their past few weeks. They have declined now, so you know, we had problems a couple months ago. They were still transferring positive cases they knew were positive. So, you know, we have just been vigilant with them and trying to get the information and try to ask for them to be as transparent as possible.
Senator McDonald, I have a question regarding the southern end. I live in Union Springs, and there's a small Indian casino there that I know from people who have gone inside. Doesn't follow any of the social distancing issues. I've been told that the machines are every seat is open, every machine is open for people. You know, and there's hundreds of people a day passing through that facility from throughout the county and joining county. So what, if anything, can be done about that?
Ed, I'm not really hearing. I was trying to follow, I couldn't really hear.
The question on the floor is the small casino that's in Union Springs, that they're not following social distancing and proper hygiene. What can be done to try to rectify that, or what is being done to rectify that?
You know, that's a very difficult situation. We've had, you know, they have, I guess, they've been responsive to the health department, but we don't have the jurisdiction over that particular location. You know, they received the information from the health department. She has had conversations with them. But ultimately, that's been a complaint that I've had with the state, and other folks across the state have been having. You know, folks that I know that go there, I implore them not to. You know, they were supposedly following rules. We were supposedly taking appointments, wiping the machines down, offering hand sanitizer, making sure folks are wearing masks. That's what we've heard. I don't know. I haven't been inside that building. So, you know, it's kind of been the honor code with them. So it's been a little frustrating. I don't know if this person who asked the question has experience there or not.
What?
Have you been there?
Have you been
No,
there?
but I live there, and I see the traffic going in and out. I know several people who do go there. I've not gone in myself, and one of those people is a brother-in-law of mine, so I have no reason to doubt what he's saying. So, you know, if you go to any of the other places, you typically have every other machine is closed down. There's at least 6 feet of distance from machine to machine. My understanding is in this particular small facility, there is no distancing whatsoever from each machine, and every single machine is up and running. So you have people sitting within 18 inches of one another, for long periods of time, and, you know, with or without a mask, that's still a very tenuous situation.
So I think what I'm picking up is that you're saying maybe they're not social distancing, and perhaps they're packing the place.
Yes.
And people are nodding, so that's good. Yeah, so that would be a complaint to the health department, and then they will have to see what they can do. You know, a large part of the response to COVID is two-pronged, right? You have personal discipline and you have enforcement. So legitimately, we have the governor breathing down our necks, or my neck, to say, local government, do your job. So at the outset of COVID, our sheriff's department, our police department, our DA, not really excited about having to enforce our own friends and neighbors about wearing masks or social distancing. Now, how does that work?
Have there been local businesses that have been fined for customers, and then who gets the fine, the customer or the business or both, or?
So it's the business. So the one level of enforcement we have been able to really utilize is our Board of Health for Cayuga County. And the Board of Health consisted of members of, there's physicians, there's county leadership, Kathleen Cuddy chairs the Board of Health, and that is the enforcement arm of the health department, and they're the ones that have gotten, calls, they get complaints, and they follow up, and could be any one of the members of the department that go into a business. Maybe they don't see masks, they don't, they take down the information that businesses sent a consent order. They are subject to a hearing and then a fine. And, a few weeks ago, the state said we could fine up to $15,000. And we could also do it retroactively. So if somebody put a party on Facebook that they had last week, we could still go, and especially if it turned out to be a super spreader, we could still go and fine them. And that's a decision of the Board of Health and their hearing officer. So,
So if a customer comes into a shop and says, I'm not wearing a mask because I have a medical excuse, and because of HIPAA, you're not allowed to ask what it is, at the hearing, the business can say, I asked him to wear a mask, but he said he had a medical excuse, and then what happens then?
well, that is accurate. So if somebody does have a medical excuse, they don't have to wear a mask. I believe the instances where the Board of Health have gotten involved is when the employees aren't wearing a mask. That's typically been, so far, what we've seen. Or somebody walks past perhaps some sort of a manager, and the manager doesn't ask them, can I provide you a mask? And doesn't see that interaction. And it's a slice in time, but I don't think that anybody is capricious in the health department who just, does a quick scan and walks out. They kind of study the situation to make sure that, they're doing the right thing.
Aileen, we got to cut you off on time, my dear. We got to cut you off on time. Thank you so much. We're coming close to the end of our meeting. But thank you so much for being our guest speaker today.
I'm happy to present to you guys today. I'm sorry this is, kind of a downer, but I'm happy to talk to you, and I'll just want to let you know I'm working my hardest to see that we can get everything that we need. And consistent free testing is what I'm advocating for on a weekly basis. So we're doing the best we can. Thank you guys. Stay safe and healthy, and enjoy the meal.
Thank you.